So today we're going to be talking about acquired supranuclear oculomotor paresis, which is sometimes called Asomp. It's acquired, not congenital. It's supranuclear, which means the problem is above the nuclei of the oculomotor nerves. It's an oculomotor problem, and that means it can look like 3, 4, 6, or any combination, and it's a palsy. So Asomp is an acquired supranuclear oculomotor palsy. It is reported to occur after cardiac surgery, but especially aortic valve surgeries. So it's a common post-cardiac surgery. It's not clear what the cause is. Now, there are some things that happen in cardiac surgery that could make it you more prone to get a lesion in the mesencephalic thalamic junction, which is where the presumptive localization is, that there's something at the thalamo-mesencephalic junction connecting the supranuclear input to the brainstem nuclei at the level of the brainstem in the midbrain. And cardiac surgery obviously has a bypass pump. There's hypothermia. There are risk factors for emboli and hypotension, as well as perfusion problems that could lead to ischemia, but it's not clear exactly what the cause of this is. In fact, usually when we do an MRI or a CT post-op, we don't see anything. So it looks like this. It's acquired. It happens after surgery. It's bilateral and conjugate. It's supranuclear, and the way that we prove that it's supranuclear is by doing the doll's head maneuver. So if we ask the patient to look right, left, up, or down, they might not be able to do it voluntarily, but if we rotate their head, the vestibular system can still talk directly to the oculomotor nuclei, and their eyes will rotate. That's what we mean by the doll's head maneuver. In addition, another interesting feature is the saccade is usually affected way more than the pursuit. So patients, when they're asked to saccade to the right or left or up or down, can't do it. But if you pursue, they can do it. And that kind of dissociation between the saccade and the pursuit means that everything from the nucleus down, nerve, muscle, and junction, has to be intact. And if you find this dissociation between the saccade and the pursuit, you're going to do the doll's head maneuver, because what you're looking for is making sure that this is not a supranuclear palsy. So normally the progressive supranuclear palsy looks like this, but it's in older people, it's progressive, it's a neurodegenerative. This is an acquired and acute post-operative supranuclear oculomotor palsy. There's no treatment. It just tends to get better over time. It's not clear even where the lesion is, but probably there's some perineuronal neural network involvement that is susceptible to diffuse bilateral and acute ischemia. And we really don't see any emboli or any other cause for this. So you need to recognize it and know what it is. It's acquired supranuclear oculomotor paresis after cardiac surgery.